Dozens of New Yorkers rallied in front of the offices of both Senator Kirsten Gillibrand and Charles Schumer.
We organized this rally today because everybody's been talking about health care reform in this country. And what people really have been focused on is the health care reform for adults. And nobody's been talking about children. And so the House has just completed a bill that does not include the needs of children.
She refers to the $894 billion health care bill, which is up for a vote. If it's passed, it would replace the Children's Health Insurance Program, better known as CHIP, for either Medicaid or private plans. The effectiveness of the new coverage will depend on where children live.
If the reform goes through, then I'm going to have a hard time paying for health insurance. It's like $160 to do it through my job a month versus $15 that I pay now for Child Health Plus for my son.
Child Health Plus is the New York version of the CHIP program for children from low-income families. Ms. Salas and advocates argue if the program is replaced, it will contribute even more into the health disparities that already exist.
It's going to be a chaos because then our community are going to rely on the emergency room. So it's going to be costly, and we need to make sure that that doesn't happen. So that's why we're here today.
How can you ask a child to wait? You don't ask a child to wait for immunization. You don't ask a child to wait when they've been through a terrible tragedy, and they need mental health care services. You don't ask a child to wait for a dentist. And so we shouldn't ask children to wait. We didn't ask the auto industry to wait. We didn't ask the banks to wait. So we're here to say to our senators, Schumer and Gillibrand, that we want them to make sure that children are considered.
Senator Schumer released a statement saying he agrees with the activists and that the program will not be lost under the health reform bill. The bill will eliminate CHIP in 2014 by expanding Medicare eligibility to children living at 150% of poverty level and shifting all children living above that level to private plans.